genetic testing could have helped. Introducing Nalagenetics, we help providers around the world unlock the power of personalized care. Real-world evidence insight in drug responses are locked behind local providers who see patients daily. To discover and make sense of these insights, we offer cost-effective genetic screening for doctors and labs to activate them first as partners, and then connect and analyze these data sets via our clinical decision support and population genetics platform. So our platform has three major components: the genetic testing service, a clinical decision support system, and a patient engagement app, which collects genetic, clinical, and patient behavior data respectively. These data sets can help physicians tailor recommendations for patients. Because their recommendations are more effective, it has a higher likelihood of being reimbursed by population managers, insurance, and pharma, and recognized as a new best practice, which in turn will drive further physician adoption. Without this approach, it may take decades before a new genetics biomarker is implemented clinically in a new population. And how does this all play out in real life? Well, you can ask Ina. Ina is one of our patients in Indonesia who was prescribed tamoxifen, a drug to prevent breast cancer from recurring. Tamoxifen in Asian patients have been proven to be less effective if the patient has a mutation in one of the genes that we test. So the doctor goes on to our app and checks for the drug gene interactions. And since Ina is eligible for our test, the clinic or hospital helps to collect the sample with a buccal swab, which is sent to one of our partner labs. Ina gets the report back in 3 to 5 days later, and Ina's doctor decides to prescribe aromatase inhibitor instead, which is more compatible with her genetic profile. And since her prescription is tailored for her and may deviate from standard practice, she records any side effects via a clinically validated survey, informing a larger knowledge base to log prescription effects. Physicians have access to this knowledge base and can see population-level insights to treat others like her. So as you can see, our IP lies in 4 different capabilities, which offer doctors and hospitals end-to-end support in answering who to test, what and how to test, what to do after testing, and whether testing is really effective. Compared to our competitors, our genetic testing kits and software can be deployed in any lab with a qPCR machine, making it more cost-effective for labs in developing countries and allowing us to rapidly scale across these markets. Our business model is B2B2C, where we sell to hospitals and labs first. COVID-19 has really opened a lot of doors for genetic screening, and we have been able to educate hospitals that traditionally only did COVID-19 screening to also do pharmacogenomics testing. These hospitals will first offer testing for patients to be paid out of pocket, but with sufficient data points, we are able to convince payers to reimburse for testing. So far, we have tested 170 plus patients since launching last year and have 10 plus ongoing clinical validations and research collaborations for different drugs with over 70 plus doctors in Southeast Asia. These are for both COVID and pharmacogenomics use cases. Our team has extensive experience in genetics discovery and translation, and actually most of us have worked together for more than 5 years since our days in Genome Institute of Singapore. We believe with JJ and Astrid's bioinformatics and populations genomics expertise, as well as clinical insights from Sandro and our advisors, we have the right team to solve this problem. So we invite you to join us in unlocking the world's genetics and improve healthcare for everybody. Thank you.